Alexis Georgia was 48 when she learned she had breast cancer last spring. Since completing her treatment at BC Cancer Clinic Kamloops, Georgia has taken up dragon boating and yoga in her off hours. Here is Georgia's story in her own words. I was doing my breast self-exam, which I did twice a year at most, and I thought I felt a lump. I made an appointment with my doctor, but I wasn't even worried. The appointment was just a precaution. My doctor did a breast exam, and she found something on the opposite side of the breast that I had found the lump on. She wanted me to have a mammogram and an ultrasound as a precaution. I still wasn't worried. We were just all being careful. I went to my local hospital for the mammogram, and the doctor kindly explained that I also needed a biopsy as a precaution. I still really didn't think it would be anything. I was in the exam room when my aunt called, letting me know that my grandmother was dying. The possibility that I had breast cancer was secondary at that point to losing my grandmother. She held on for a few days, and then she passed away. A few days later, I received the call and the diagnosis of my breast cancer. It was just the most awful week. The lump I found turned out to be nothing, but the lump my doctor found turned out to be cancer. I feel stupidly lucky. If I hadn't gone in for the benign lump that I found, my doctor never would have found the other lump with cancer. It was just shocking.
Hi Alexis.
Hi.
Nice to see you again. So, I'm really sorry to tell you, but the results came back from your biopsy and the lump we had found turns out to be cancerous. So that means you do have breast cancer.
But I've been so healthy. What did I do to get cancer? Should I eat more blueberries? Should I eat more turmeric? I've been so healthy all my life. What did I do to get cancer?
It's not your fault, and I want you to know that it's not your fault at all. There are things you can do to reduce your risk of getting cancer, but cancer can be random, and that's the scariest part.
One of my biggest fears was that I would be overwhelmed with the amount of options and information, and I wouldn't know what to do. But my healthcare team made sure that I knew exactly what was happening, what my options were, and what they recommended and why. I wasn't overwhelmed at all. It was such a relief, actually. I went from feeling so overwhelmed and alone to feeling like I had a whole army of a hospital behind me tackling this.